This is Alicia Alt, reporting for the Global Medical News Network from Capitol Hill. At a press briefing at the Senate Russell Office Building, attended by several members of Congress, the Premier Healthcare Alliance unveiled a new collaborative of health systems that are aiming to become among the nation's first accountable care organizations, or ACOs. ACOs are expected to be the backbone of the new health delivery system, but they are still loosely defined. I asked Dr. Nicholas Wolter, CEO of the Billings Clinic in Billings, Montana, to explain more about the ACO concept.
What would your definition of an accountable care organization be?
Well, this concept came out of some work by the Dartmouth group, as well as some work MedPAC did several years ago. The idea being that if doctors and hospitals and other providers work more closely together, they could coordinate the care of patients across silos and over time, and be more accountable for how we look at the cost that's driven by fragmentation.
And you have mentioned as potential examples the Geisinger Clinic, Fairview. A lot of criticism has been we can't replicate this model everywhere. What do you say to that?
Well, I think the model is potentially replicable in most places, although it does involve trust, physicians being willing to work with hospitals and vice versa. And of course that territory varies quite a bit from community to community. But I mentioned Fairview because that's an example where a hospital system that employs some physicians is also working with independent private practitioners and an insurer to create a form of an accountable care organization. That tells me this can happen even in communities where the relationships are amongst independent practitioners.
And your advice to independent practitioners who are looking at this and feeling like maybe they can't be a part of it or they won't be a part of it, or what should they be doing?
I would say at the very least watch this closely. Talk to your colleagues around the country who might be early adopters. There could be opportunities in this to have a rewarding practice, to take care of patients differently, although of course there will be concerns and worries about who's in control. There's going to be different ways that providers can participate in these models. Medical home may be a good way to start. Watch this closely because there will be a lot of activity.
For the Global Medical News Network, this is Alicia Alt.